Well, good morning and welcome to Ogden Surgical Medical Society 2019. We hope that you were able to come last night, but if not, we're grateful that you're here today. First of all, I'm going to have President Webb do a little bit of housekeeping regarding how to use those apps if you don't know how to use them, and other such explanatory information such as who gets to help with the dishes if you didn't know that. Go ahead.
Brief. There is an app that is associated with our meeting, and it's very useful. It helps you schedule, but it also makes doing post-CME surveys very easy. And so to get that app, you go to your app store, depending on which model phone you have, and you search Event Mobi, and you can see that up on the slide. Once you get to that and you've downloaded it, it'll ask for a code. That code is OSMS, and that will give you the program. And then once you've gotten to the program, you download each event that you attend. And then it's fairly self-explanatory as to how to fill out your CME evaluations. If you have any questions at all, Karina and Jason at the front desk at registration can help. Also wanted to let you know that there's a poster session from 10 a.m., starting at 10 a.m. in room 320. We'd ask that you attend that. That's research that has been done by our family medicine residents as well as Weber State students. So take a look at those posters and vote for your favorite. There's going to be ongoing book signing out in the lobby, and that's over on this side of the lobby. Today, I believe Twyla Bird and Scott Rigsby will be doing book signings. And then tonight at 6 p.m. Is the McKay-D Hospital Family Physician Night at the George S. Eccles Dinosaur Park. And that's starting at 6. Tomorrow night, there's going to be the Ogden Regional Medical Center reception and dinner starting at 6:30. Also, just want to express thanks to all of our vendors and ask that you get out and take a look at those vendor booths. If you look on the Event Mobi app, you can see there's something called gamification. If you participate in that with our vendors, you're going to be entered into a drawing for a GoPro camera. And with that, I'm going to ask that you silence your cell phones, and I'm going to turn the time back over to Dr. Campbell.
Well, it's perfect. Well, it's always a pleasure to introduce Dr. Doug Anderson. Doug Anderson is a very valuable member of our medical community and one of my personal physicians, so I'm grateful for his work and his service. In fact, I'm as beautiful as I am partly because of him. I was in a motor vehicle accident and the left side of my face was crushed, and he was the surgeon that put me back together. And afterwards, I asked that surely he could have at least made me look better, but I'm no worse than I was, so I'm grateful for that. So, Doug, this is the rules. So you have until 8 o'clock. At about 5 minutes till, I will stand up and ask if there are any questions. So we have a very quick 25 minutes for what's new in your specialty. Doug Anderson, ENT, you're on.
Well, it's always great to be with you. I love this meeting and enjoy the collegiality of being able to get to know many of you and rub shoulders with you and learn from all of you. So thank you very much for having me. Today, I would like to speak on sleep apnea and what's new in sleep apnea. But first, we'll discuss a little bit about the importance of sleep, some of the unusual circumstances associated with what happens if we don't get enough sleep, and then discuss some of the current therapies that have been used, and then maybe what's new on the horizon as far as therapies. Let's see. See if I get this right. Is that right? Okay. So I have this, well, many of you are looking at this slide. When we think of March Madness, we think of basketball, we think of filling out our brackets, we think of hoping that the team we pick will finally be the champion of the tournament. But many times we're disappointed, as is often, despite how much we study and review and listen to the experts, it's hard to pick who's going to be the champion. But for other people, March has another March Madness associated with it, and that's for the people that want to know more about sleep. Whoop. You see, March is the time when we move our clocks forward and we participate in daylight savings time. It's also the month that we celebrate or recognize National Sleep Awareness Month. And I don't believe it's a coincidence that these are both in the same month. You know, there's some unusual facts, you may say March Madness, that is associated with moving our clocks forward just an hour. For example, did you know that there's been an increase in motor vehicle accidents surrounding the time of moving our clocks forward, an increase in workplace accidents, increase in heart attacks by up to 5%, increase in cyber loafing at work, and increase in cluster headaches? So you can imagine that if moving our clocks forward just an hour or behind just an hour has that kind of effect on our health, what would happen to us if over a prolonged period of time we are getting maybe several hours less of sleep? So many studies have found that there's many things that contribute to our health that are important and that occur while we sleep. Those include that while we sleep, there is healing and repairing of our heart and blood vessels. We also have found that ongoing sleep deficiency is associated with an increase in stress hormones that cause inflammation of our gut. Sleep deficiency is linked to increased risk of heart disease, kidney disease, hypertension, type 2 diabetes, and stroke. Sleep deprivation also causes elevation of proteins, which are associated with Alzheimer's disease and other neurologic diseases. You know, we live in a wonderful society. There's so many things to do, and sometimes it doesn't seem like there's just enough time in the day to do it. And so we find ourselves waking up early in the morning to jog or go hiking. We stay up late at night so that we can go to a midnight movie or to go shopping late at night. But unfortunately, because of that, we are sleeping less, and the quality of our sleep is less. Now, our society is very concerned with our appearance. We're concerned with our diet. We're concerned with exercising a lot. But sometimes we forget the importance of sleep, which is probably equally as important. So I wanted to go over the top 10 reasons. If you didn't know why it's important that you should get more sleep, I want to go over top 10 reasons that you could remember and write down that you should do in order, or remember, so that you will try and get more sleep. Number 1, poor sleep makes you fat. Good sleepers eat fewer calories. Sleep deprivation disrupts daily fluctuation of appetite hormones such as ghrelin and leptin. Good sleep can improve concentration. In fact, studies have shown that interns who are deprived of sleep made 36% more serious medical errors than those who were encouraged to get at least 6 to 8 hours of sleep. Good sleep has been shown to maximize athletic performance. Studies have been done on basketball players where they were encouraged to have at least 8 hours of sleep, and the results showed that they had increased speed, they were more accurate in their skills, they had improved reaction times, and they had an improved mental well-being. Sleep deprivation has been shown to affect glucose metabolism and increase the risk of developing type 2 diabetes. In fact, studies done on young subjects, when they were limited to just 4 hours of sleep a night, it showed that within a week they started showing early signs of type 2 diabetes. So it's amazing that within a week they could start showing problems with diabetes. But after a week of having restorative sleep, those findings resolved or went away. Poor sleep is linked to depression. Sleep improves immune function. And poor sleep is linked to long-term inflammation of the digestive tract. And we know that sleep deprivation affects emotions and social interactions. So what is sleep apnea? There's different kinds, of course. There's obstructive sleep apnea, which is a decrease or halt in airflow despite efforts that our body makes to take a breath. There's central sleep apnea, where there is a diminished or absent effort to take a breath. And then there's a mix of the two. The amazing thing is that this is quite a common disease, and I would bet there's quite a few of you out there that have this, or at least know people in your family that have it. But it affects 25 million adults in the U.S. 26% of adults between ages 30 and 70 are also affected. The costs are staggering. It is estimated that there are between 67 and $165 billion in annual costs due to sleep apnea. 87 billion of which is due to loss in productivity, 26 billion in traffic accidents, 6.5 billion in workplace accidents, between $2 and $10 billion to diagnose and treat moderate obstructive sleep apnea per year. That's significant. It is a national health concern, and Dr. Timothy Morgenthaler, who is the spokesperson for the Healthy Sleep Project, said, obstructive sleep apnea is destroying the health of millions of Americans. And more importantly, he said, the effective treatment of sleep apnea is one of the keys to success as our nation attempts to reduce healthcare spending and improve chronic disease management. That's a big statement to make. And the reason that is true is that because sleep apnea is associated with many other health conditions, such as hypertension, heart attacks, arrhythmias, stroke, memory loss, attention deficit disorders, diabetes, depression, sexual dysfunction, motor vehicle accidents, and obesity. Interestingly enough, there have been neuroimaging studies that show that there is a significant reduction in white matter integrity, and that also the studies have shown that there is impaired cognition, mood, and daytime alertness. Fortunately, after 1 year of CPAP therapy, those changes that were found to occur in the brain were able to be almost completely reversed. So we all know, most of us know, that the ways we go about diagnosing sleep apnea, which are history, you could use a videotape, a baseline oximetry study. Now they have pretty good in-home sleep studies, and of course the traditional in-lab sleep studies, which can be spendy at times. The important diagnostic parameters that are looked for during a sleep study are the apnea-hypopnea index, the oxygen desaturation events that occur, the decrease in airflow, and increased number of arousals. Now, there are many treatments that are out there that have been medically proven to be effective. There are many more that are out there on the internet that I see all the time that are proposed to work, and whether they do or not, I'm not sure, but weight loss has shown that if we lose even up to 10% of our body weight, that there can be significant improvement in our sleep disordered breathing. We should avoid sedation, alcohol, and sedating meds at night. Positive airway pressure devices are common, in fact, the gold standard currently for treatment, including CPAP, AutoPAP, BiPAP, and EPAP. Oral appliances, and then the new oral pressure therapy device where there's a little mouth device placed in the mouth with a tubing that has a little vacuum that sort of sucks the tongue forward when you sleep at night. There's other things such as nasal surgery, decongestants, breathe-right tapes, and positional therapy. And of course, we all know about the many different upper airway surgeries that can be performed to help improve the diameter of the airway while we sleep. Some of those include the tongue suspension procedure, the hyoid suspension procedure, the UP3, the osteotomies with genioglossus advancement, and the osteotomies with maxillary mandibular advancements. But again, the gold standard for treatment is really the nasal or full face mask CPAP. Now, I've been in practice over 20 years, and it seems like for as long as I can remember, the therapy has been about the same. But in 2014, there's been a new therapy that has been approved by the FDA, And it's exciting to me because I think it helps a lot of those patients that haven't found success with the other modes of therapy we have. And this is called the hypoglossal nerve stimulator. It's a new approach using proven technology that's used in pacemakers, for example. And the Cleveland Clinic ranked the hypoglossal nerve stimulator device number 2 on the list of top 10 medical innovations for 2018. So let's see, how do I play this then, if I want to do it? So this is a little video that talks about it.
I keep the remote control right next to my bed. I simply just reach over and turn it on every night and go off to sleep 30 minutes later, and I don't wake up when it starts and activates. And very easy to use. It's like push a button and go to sleep.
Inspire therapy is a new treatment for obstructive sleep apnea. As a physician, what I really like about this therapy is that it addresses the root cause of the problem. During sleep, the muscles and soft tissues of the throat can relax, block the airway, and cause apnea events. The Inspire device delivers mild stimulation to these key airway muscles and gently moves the tongue and other soft tissues out of the airway so you can breathe at night. You can see in this animation what it looks like. The back of the airway is now clear and the patient can breathe during sleep. We're using proven technologies that are used every day with other similar medical devices, and now we're just applying them to treat sleep apnea. It's a very simple concept, and it's all under control of the patient with the sleep remote. You turn it on at night before you go to sleep and off when you wake up.
I just have the remote that turns it on and off, and when I first turn it on, it will just move my tongue one time like it would move it during the night, just to let me know that I have it on. And then it gives me half an hour to go to sleep.
It's more like an involuntary muscle movement. There's no pain associated with it at all. It's just simply the movement.
It's a way of life that's very simple to incorporate. It's like getting up and brushing your teeth every day.
Now, as I said before, CPAP therapy is probably the gold standard right now that most insurance companies approved for the treatment of sleep apnea. And then if patients fail that, then there's some other options that can be considered. It's felt that if a person tolerates the CPAP mask, that it can be successful in 100% of patients as far as resolving sleep apnea, obstructive sleep apnea. The problem is, as you know, there's a significant number of patients out there that for some reason can't get the right fit with their mask or have claustrophobia or just can't tolerate the CPAP mask. And so this, to me, is an exciting therapy because it provides these other patients that many of us know with an alternative option. And so I'm excited about this. So the great thing about this therapy is it really addresses, as that video explained, the posterior oral pharynx, where the palate and the base of tongue collapse. During sleep we are relaxed, our tissues are sort of floppy, they fall back in the back of the throat, and as we breathe in, it sort of pulls, that vacuum effect sort of pulls those tissues to the back of the throat. So the hypoglossal nerve stimulator is the nerve that controls the muscles of movement of the tongue. So it's a motor nerve. It stiffens the tongue, it protrudes it forward, and it keeps it out of the airway. And there's a mechanical coupling device with the muscles of the soft palate that pulls that out of the airway also. So, and I don't know if you can click on each individual of these pictures on the bottom. There's a little video with each one. This is the airway during sleep behind the tongue. Someone with sleep apnea, you can see how small that airway is. It's like breathing through less than a straw or a straw. So that's the base of the tongue. This video is behind the soft palate, and again, not much of an airway. In a patient that's had the hypoglossal nerve stimulator implantation, you can see the airway is much improved. There's the vocal cords down there, and this, again, the palate is pulled way forward. So significant improvement in these patients. So that's the exciting thing about sleep apnea, is much improved breathing. The genius, though, of this hypoglossal nerve stimulator is that it times the stiffening of the tongue and the protrusion of the tongue with inspiration. So it's just not all the time pushed forward. It times it, it senses when you're taking a breath, and at that time it pushes the tongue and the soft palate out of the way. So here's a picture of a polysomnogram reading, and you can see in this picture that the body is trying to breathe, and there's little artifacts showing that they're breathing, and then we're not breathing, and the oxygen saturation is dropping down and then going back up. But in a person that has a hypoglossal nerve stimulator turned on, there's just uninterrupted sleep and sleep wave patterns that is much more restful to our bodies and to our mind. And so we don't get this uninterrupted sleep that makes us exhausted in the morning and ultimately affects our memory. So the sleep apnea uses a small little battery that's about the size of I brought one, but I think I left it on my table, but it's about the size of a silver dollar. It's about this thick. It sits right here underneath this, right on top of the muscle of the chest, underneath the fat, and it lasts about 10 to 11 years, and MRIs can be successfully done if the specific guidelines are followed. So now we have a 5-year study that's been out there. It's a prospective study in I think 22 centers that really have showed that sleep apnea, for these patients that were enrolled, they had an average of 29.3 events per hour of sleep, which is right at the border of moderate to severe sleep apnea. And after 5 years, the results, the improvement is maintained. So on average, they had 6.2 events per hour of sleep. And the quality of life scale of the Epworth Sleepiness Scale shows that, again, patients at the start of the study were in the abnormal range, and at the end of 5 years maintained this normal feeling of that were rested during the day and not sleepy. At the start of the study, only 17% of the patients that had sleep apnea could say they had little or no snoring. But at the end of 5 years, 90% of patients said they had no or only soft snoring. And the adhered post-registry study showed that patients, on average, even after 1 year of use, used it on average about close to nearly 6 hours per night of sleep, and there was a 93% strongly satisfied or satisfied patient rating. This is just a quick little video of a patient, and this was put on by CBS News. If you could run the video. So a patient that is like many of the patients you know, they had sleep apnea, is tired, their memory's shot.
In our morning rounds, a treatment offering hope for millions of sleep apnea patients. The disorder causes people to stop breathing when they're asleep. An estimated 22 million Americans suffer from sleep apnea. It puts them at greater risk for diabetes, heart disease, stroke, and memory loss. Patients who are older, overweight, and male are generally most at risk. David Begnaud shows us the new option helping some patients. David, good morning.
Nora, good morning. For those who struggle with sleep apnea, treatments like the CPAP machine can be hard to sleep with. They don't always work, and a lot of people just can't get a full night's sleep with it. But now there's a new FDA-approved device called Inspire, and it's gaining popularity. For some people, it's a last resort. Their life literally depends on it. The Cleveland Clinic named this kind of treatment #2 on its list of top medical innovations for 2018. We met a woman who finally found relief after more than 2 decades of trying to get a good night's rest.
I wasn't breathing. I wasn't getting the correct amount of oxygen. My thought process had gone.
Good job!
Peggy Saravo's memory got so bad, her family thought she had dementia. The 59-year-old was so exhausted, she says she could barely do her job as a nurse.
So people were noticing it, but you were too.
I was too.
You knew something wasn't right.
I knew, not as quickly as they did, but I knew I was in trouble.
Peggy has severe obstructive sleep apnea, where her throat muscles relax, blocking her airway and disrupting her sleep. On average, she stops breathing 53 times an hour. That's nearly once every minute during a night's sleep.
Give me an example of a night.
Up 4 hours, maybe sleep 2. This is the area where I would sleep.
Oxygen machine,
correct.
CPAP.
Correct.
She tried other treatments.
Take the mask, bring it over my face like this.
She did not find relief from the CPAP machine, a common treatment that delivers constant pressurized air.
The CPAP wasn't getting the job done, so you needed oxygen on top of that.
Exactly. And then that didn't work. That's when they introduced me to Inspire and saved my life.
Inspire is a pacemaker-like device implanted in the chest. It senses when your breathing slows down and sends an electric pulse to the tongue to stimulate it forward, keeping the airway open.
This has been revolutionary. It's been a game changer.
Dr. Maurits Boone is Peggy's doctor at Thomas Jefferson Memorial Hospital in Philadelphia.
She'd given up. She had memory issues. She was miserable. This is not a benign disease. As I said, this is a killer, and it actually shortens people's lives.
I didn't realize I had it so bad.
A few months after having the Inspire device implanted,
You just need to relax and breathe normally.
Peggy went to a sleep lab to see how it was working.
All right, so listen for me on the intercom, okay? Okay, great. Good night.
They ran tests throughout the night, and early the next morning, Dr. Boone revealed the results.
So before we activated the device, we have all sorts of problems. This is basically your brain saying, I'm not breathing, I need to do something about it. And after we activate the device, it's perfect. Look at your oxygen. Nice, stable, flat line, staying around 96, 97%. So this is good as it gets.
Okay.
And as far as I'm concerned, this is a cure. This is awesome.
A study in the New England Journal of Medicine found that more than 2/3 of patients experience less sleep apnea after getting the implant.
It was like sleeping with a herd of elephants.
For years, all Peggy and her husband David wanted was a good night's rest. And now they're finally getting it.
I'm going to show you.
Every night, Peggy turns on the implant right before going to sleep.
What's it like to sleep now?
Great. Turn myself on. Go to sleep. And I sleep, and then I get up, and I turn myself off. And I have a normal day like you and everybody else.
Come here, Max. Come here, Doodles.
It doesn't work for everybody, but man, it worked for you.
It sure did.
These are the current indications for patients who want to consider having a hypoglossal nerve stimulator implantation. And do I have any questions? Oh, so that's a great question. You know, so it's something that is, surprisingly approved by many insurances. I mean, the cost would be a lot of money if you had to pay cash. So no one really does it if they pay cash. So it would be the cost of your copay. But surprisingly, a lot of insurances are covering it. It's been just put on the federal Blue Cross plan, the Blue Cross Blue Shield plan. It's on Select Med plans. And so a lot of insurances are paying for it. And so why would you say, why would they pay for it if it's so expensive? Because it really works. And when they put it out to independent review, they found that it's successful. And it really decreases the cost of health care because it helps reverse a lot of other problems, neurologic problems, heart problems, high blood pressure problems, diabetes problems. So it really makes it cost effective. Yes? So yes, I think the dental device is great. In general, we use those for more mild sleep apnea, and we refer a lot of patients to get those done. So again, this is for more moderate to severe sleep apnea. Go ahead. Just the battery. So just like a pacemaker, just cut down, and there's some wires. You just unplug the wires and plug in a new battery, and so it's currently about an 11-year thing on the battery. Well, so that's a great question. So we have patients during the first year, they come in and we interrogate the device and with a little laptop, and we can tell how it's working and can adjust it, so they can.
We do have microphones, so if you have questions, please go to the microphone so everybody can hear them, and we have about 2 more minutes for questions. Go ahead.
So what is the price tag? What is the price tag?
Yeah, so that's a great question. I can tell you that the device itself, just the device itself, if you were to pay cash for it, is about $19,000, so it's an expensive thing. But that doesn't include the cost of the hospital facility and the physician fee and the anesthesia fee. So it's much more than that. It's probably at least double that. But again, surprisingly, it's covered by insurances. So it's whatever, you wouldn't want to pay for it with cash, but if you had a $5,000 deductible, it would cover it. But as you can see, the cost of an in-lab sleep study can be, several $1,000s also. So.
When you see a new patient with atrial fib referred to you, make sure you evaluate them very heavily for sleep apnea. I have it. I sent so many patients to the sleep doctor, he used to send me a basket of fruit for Christmas every year.
Yeah, so that's a great thought. You know, so many of you treat people with hypertension, diabetes, depression, other things like that. And unbeknownst to you, maybe they don't have a diagnosis of sleep apnea, but with a little extra questioning, you might find that they have sleep apnea, and you may be able to better treat their other symptoms if you treat their sleep apnea.
Is there an increased risk of cardiac arrhythmias or sudden cardiac death with this device?
No, there's not at all. So there hasn't been any of that at all. In fact, it's been implanted that people that have a pacemaker on the one side and a hypoglossal nerve stimulator on the other side, and there hasn't been any a problem with those. Yes?
Yes, just curious, I'm wearing my Fitbit, which gives me a sleep pattern every morning of
Yeah.
how much REM and wakefulness and all that.
That's awesome.
I used to be a respiratory therapist before I got to PA school, and I'm very interested in the whole sleep apnea thing. I know it affects people. My mother had it. She had dementia and died of heart failure eventually, and she had trouble tolerating the mask. She's passed away now, but this would have been great for her. My question is, the wearable health technologies like Fitbit, are we any closer to having a device that would track O2, you know, like the pulse ox, but on a wearable device, downloadable, so that it could raise the lay public's awareness about they're not getting the sleep they need, and to seek medical advice?
Yeah, I'm sure there are technology available already that does that, but I don't know how wearable it is. But I know that they're getting a lot better on a lot of those kind of things on those watches. So that's a great question. Thank you. Any other questions? Oh, yes, sorry.
Do you go to CPAP? Do you go to this device only after CPAP doesn't work?
Yes. So the requirements are that you have to have tried CPAP and failed it, and then you could submit it to an insurance company.
If this device doesn't work, then what's the alternative?
So that's a great question. So there's still the other options available. There's upper airway surgeries. There's ultimately, if it's bad enough, there's a tracheotomy. But so it doesn't work 100% of the time. I think the studies that I put up here, it's between 68 and 78% of the time. Some people have other issues with central sleep apnea or low oxygen level, and so I'm not saying it's a cure-all for everyone, but it's an alternative that has similar success rate to a CPAP. So it's great for those people that don't tolerate a CPAP. And that's a great question. I wish it would cure everyone, but it doesn't. It doesn't cure everyone, but it does cure 7 out of 10, 8 out of 10 people. So, and these are people that we're talking about that have already failed CPAP. The 7 out of 10 that are being cured, they've already failed CPAP. Many of them have already had upper airway surgeries, and so of those people that are failures, you're increasing success by another 70% on top of that. So it's a benefit.
Well, thank you, Doug. We want to mention that Ogden Clinic was his sponsor, and we're grateful for them. Quick round of applause for Doug Anderson.